How does immunotherapy create pancreatic cancer super responders? Imagine a tiny army inside your body that can recognize and fight cancer cells. That's what immunotherapy aims to do. In some rare cases of pancreatic cancer, this army becomes exceptionally effective, turning patients into what we call super responders. But how does this happen? It all starts with the immune system's ability to identify special markers on cancer cells called neoantigens. These neoantigens are proteins that result from mutations unique to each tumor. Think of them as a secret code that cancer cells develop to hide from the immune system. When immunotherapy works, it helps the immune cells, especially T cells, see these neoantigens clearly, like turning on a spotlight on the hidden enemy. In some patients, their T cells recognize these neoantigens very strongly and remember them for years. This immune memory means the body can keep fighting the cancer long after treatment. These patients often experience long-lasting tumor control or even complete regression. This is especially interesting because pancreatic tumors usually have a tough time being detected by the immune system. They create a dense, protective environment that blocks immune cells from entering and attacking. But in super responders, something about their tumor or immune environment allows the immune system to break through this barrier. Drugs called immune checkpoint inhibitors, like pembrolizumab and nivolumab, help by blocking signals that tumors use to turn off immune responses. These drugs are most effective in patients whose tumors have a high level of microsatellite instability, a genetic feature that makes tumors more visible to the immune system. However, most pancreatic cancers do not have this feature, which is why only a small number of patients respond well. Researchers are exploring other ways to boost the immune response, such as personalized vaccines that train the immune system to recognize specific neoantigens unique to each patient. These vaccines aim to activate T cells and create a long-lasting immune defense. Another promising area is the development of therapies like CAR T cells, which are engineered immune cells designed to target pancreatic cancer-specific proteins. These approaches are still in early stages but hold potential for increasing response rates. The key is understanding why some patients become super responders. It often involves differences in the tumor's genetic makeup, the immune environment surrounding the tumor, and how well the immune system can infiltrate and attack the cancer. In summary, immunotherapy can create super responders in pancreatic cancer by helping the immune system recognize and attack tumor-specific neoantigens. When the immune cells can effectively identify these markers and remember them, they can keep fighting the cancer for years. This process depends on a complex interplay of tumor genetics, immune environment, and innovative treatments. Ongoing research is vital to find ways to make these responses more common and help more patients benefit from immunotherapy. If you or someone you know is exploring treatment options, always consult with healthcare professionals to understand what might work best for individual circumstances.